Okay, so today I'm going to go through the processes menu and the reports menu. There are some items that are listed under the processes menu that our clinical team will be going through, so I won't be discussing any of those. I'll tell you which ones we are as I go right by them. And also there are some options that are in the reports menu that our clinical team will be showing you how to use those reports. So I'll tell you which ones those are as I skim right by those as well. So let's start with the processes menu. Under the processes menu, the first item I want to talk about is the associate payroll. Now, the associate payroll, this is where you can view your payroll report information, so you can look at it before you actually close the payroll cycle. In CareFishent, you'll also be able to see the finalized report in CareFishent. Now, you will have access to multiple agencies, and depending on the home agency you've assigned them to is what agency their report will show up in. So I'm going to be working with one that says ready to close. So in CareFishent, your agency master file, we've identified what your close cycle looks like. So if you do a weekly payroll close, we'll identify it as weekly. If you do a bi-weekly, we'll identify it as that, a semi-monthly. I've seen one or two offices that do a monthly payroll. So we identify that. We also identify what day your payroll closes on. So if you have a weekly payroll and your last date for payroll is on a Friday, so we identify the week ending date for that payroll close. In addition to that, we identify another date when you actually want to finalize your payroll. So for example, if your payroll is to go through Friday, you would have a couple of days to get all of that information in the system, verified, any corrections, all of that. And then your actual, where you close the payroll or want to finish it up or finalize it, would be the following Tuesday. So we have that information in the system as well, and it's part of the guidance for closing payroll. So as you can see, I'm a little far behind on closing payroll. I think caregivers would shoot me if I didn't pay them for 6 months. But this is my cycle that I'm ready to close for. You have several different icons that sit at the far right. The first one is for viewing the payroll transaction. So you get to see the detailed transaction information that creates the payroll. So you'll see all the services that you've verified, any pay-onlys you've added, travel time, mileage reimbursement, any of those things that you've put into the system. Well, you can see on this preliminary report. Then there is a summary report, and the summary report, most locations don't use it because all it really shows is total number of units by dollar amount. So if you paid somebody $60 and had 4 units, and you paid that same person $75 and had 2 units, that's what it shows. There's no detail with it. You'll also be able to close your payroll once you complete reviewing and making all the appropriate changes. And so this icon allows you to close your payroll. The next one over allows you to view the payroll history. So once you close your payroll, then that report will drop into payroll history. So that those are your final reports. Then you do have a spreadsheet version of your preliminary report. So you can actually use a spreadsheet if you don't want to use the PDF version. So this is the PDF, and this would be the spreadsheet for your preliminary report. I'm going to open up the PDF version so you can see what the detailed report looks like. And so when you're looking at this report, you'll see by associate name. Totals are at the top connected to the associate name, and you'll see by units. pay rates, total pay if you're paying hourly or by multiple units, who the patient is that's saying if when you verify an actual service, the type of service you're paying for. If you have pay-only situations, you may or may not have a patient name. Could be things like in-service case conferences, IDT meetings, and so on. So those would be your pay-only. You'll see dates associated with the services you verified, the actual time for the service you verified. If you're collecting travel miles and travel duration, that information shows on here as well. And since you have more than one agency, your agency, the work agencies will appear under the agency name column. So when you first set up your associates, they get assigned to a home agency, which is typically the agency where their HR file is kept. And so that would be their home agency. This will show all the agencies they worked for. Okay, now if you are looking at this report and you know services should have been verified and you don't see them on the report, then you're going to want to go, and I'll take you the path real quick. You're going to want to go to your patients menu, your verifications option, and the verify services option. So you'll be looking for the services that you need to verify, and then you'll verify those services. So that allows you to find and verify services. Also, if you're missing any pay-only information, you would take the same path to add any pay-only. If you are going to add supplies separately from services, you can take the same path. So that would be the path for adding um, additional records to the payroll report. Now, you'll also, while you're reviewing the payroll report, if you see anything wrong with it, like the wrong service was pulled up, or you've got wrong times, or you do reimburse for travel time and mileage and that didn't get entered or was entered correctly, you would come the same path, patients, verifications, and this time you'd select adjust verified services. And when you are looking for adjust verified services, you'll be searching for that specific service that you have previously verified and make any of the appropriate changes you need to from a payroll perspective. So when you're through, you are able to run this report multiple times. So if you've made some changes to it, you can run the report. If you need to make more changes to it, make more changes and then run the report again and so on. So once you're comfortable that you have all of the corrections made, you have all the services verified for this payroll cycle, then the next thing you're going to do is close the payroll. So that's this icon where it says close payroll. It's real simple. You just select this icon and say, okay to closing the payroll. It will advance the payroll cutoff to your next payroll close cycle, which is what we have in the system. So this moved this forward from the 12th to the 19th. It'll tell you when it was processed and who did it. Now, after you close the payroll, you can get to the payroll reports by selecting the View Payroll History. So I'm going to select this icon, and here's the report that I just closed. So you'll have your report that you closed. If you need to look at any previous reports, those are all available to you on this screen as well. You have both the detail and summary report here. This looks just like the detailed report that you were looking at when you were reviewing and making edits and updating. The only difference is this one you can't make any more changes to. This is a closed report. You also have the summary version of this report, and just to show you what the summary looks like, you can see that it just has the names, pay units, pay rate, and dollar amount. So that's the summary. And like I said, most locations don't even work with the summary report because they're more interested in reviewing the detail. But that's what the summary report looks like. Then you do have your spreadsheet where you can export this final report. Now, because this is in a spreadsheet, if you need to make a correction to it for some reason before you enter payroll information into your payroll system, you can correct the spreadsheet. Just now it doesn't change anything in the system. All you're doing is changing the spreadsheet. Now, when you export this, if your payroll system allows you to upload some type of spreadsheet, which they're usually a .csv format, but if it allows you to upload some type of spreadsheet, you can organize this differently. You could add things to it that may be missing. You can remove things from it you don't need. You can put new subtotals and totals on it and so on. Whatever your payroll system would need for you to be able to upload this into their system correctly. Okay, so next time you come through this, and hopefully you're a little more timely than I am, this will either say no transactions, or you will have some transactions, but you won't be able to close the payroll yet. So because you can continue verifying services after the payroll cycle, it knows if that service is dated a day after your payroll week ending, it knows to do that. So it'll put it in the next payroll cycle for you automatically. So you may have some that say no open transactions, or you could have some that say transactions. Then when you're ready to close it, it'll come up with ready to close, and you can start working with the reports then and finalize it and close your next payroll cycle. Okay, so let's move on to the next piece. This one's called associate time entry. Now, you can set this up so that your caregivers can enter this information into the system. It would be just like they were completing a timesheet on a piece of paper. The only thing that can be entered through this option are pay-only situations. So they could be case conferences, team meetings, IDT, in-service, anything that is not related to patient care, which comes from your patient schedules. So you can give permission to an associate to add this information in for themselves. Also, if you decide you don't want to go that route, don't give them permission to do that. They may be turning in some type of time sheet that has all of that non-patient care time on it. There's a separate permission that would allow somebody in the office to enter all that information for an associate on this screen. Now, I have it where I can enter this information for other associates. If you want them to enter their own time, then they will not be able to select any other associate from this drop-down. Now, when you're working with this screen, we actually are defaulting it to current day. It's the easiest way to work with it is one day at a time. So I'm going to back this up so I can get some records on my screen. Okay, so this is what this individual schedule looks like on the 20th. That's the day I'm working with. I can add my non-patient care time in between all of this. So when I'm working with this, if I want to add a non-patient care time situation, all I have to do is select this little plus sign, and I can insert one of the items in between them. So let's say that this person was going to come in to the office for some reason. I'm not going to select a patient this time. So let's say they're coming in for a case conference visit. And I'm going to put in here that they're going to be here from 9:45 to 10:30. If you're keeping track of the travel time between that visit and coming into the office, maybe you can put in that it took them 15 minutes, and mileage you can put in, let's say it took 5. You can also include any type of comments in this section. So you can update the comments information. Okay, so if you look below, you can see that I've got my schedule on this screen too, so I can see what this whole thing is going to look like. So I know I'm doing it between 9 and 11, so it's 9:45 to 10:30, and I took 15 minutes for travel, so you know that should fit correctly. You can, on the screen, hit your save and add more to add another one, and that one will insert that time. So my next time went from 11 to 11:45, and then their next scheduled service was 3 to 4. Maybe you had them come back in the office from 1 to 2, so you could enter some information. Let's say you were doing an orientation for them. You can put in 1 p.m. to 2 p.m. Some locations do pay for the travel time it took when there's that much of a gap between between services, and some don't. So if you were thinking they were left at 11:45 and this was at 1, maybe wherever they were at, it took them 20 minutes to get where you were at instead of home to the office, and you could put in the mileage. So that's based on how you'd set up your pay practices. Then I'm going to go ahead and hit my save and close. I forgot to change my mileage. I'll hit my save and save it this time so it closes it. And so now it brings me back to this screen that has this information on the screen. You can see where I've inserted the items. The individual can change the information, so these 2 items can be edited, they can be deleted. And if there are any comments, you can hover over the comment section and it'll show the comments you've entered. So again, if you give this to individual associates to enter their own time, that's all they can do are these items, which are classified as pay only. They do not have any control over anything that was scheduled for services. So they just see the services so they can figure out where they can insert their time in between them. Now, when you're working with this, we do give you a set of totals sitting up above the grid. So you'd be able to see anything associated with service, pay only hours, travel hours, and total of all the hours and mileage. So you will see all of that. Now there's one more feature. If you want your caregivers that are putting in their non-patient care time to verify these items, then you can select the verify, and that's all it will verify. It will not verify any of the other services. And so my other services had already been verified, so these will show up as verified. So if they weren't verified, they'd still show up as needing to be verified. Mine just happened to be set for my example. So they can do that and verify their own pay only information. So that just eliminates you having to verify them for everybody. So if you had a lot of these, it just saves you some time verifying that information. Now, if you're reviewing your payroll report, then you can look at the detail information. You can see all that information. And if you think it needs to be changed or corrected or something's missing, then you would correct all of that as part of your payroll close process. You can create reports from here, so you can get them either in a PDF or a spreadsheet version of the listing. And you can also get one that shows you the patient totals if there are totals related to patient information. So you do have the ability to create reports. Now, I had mentioned that I ran this from one day at a time. I'll just show you what this would look like if you ran it for multiples. You have to try to figure out where to insert stuff in these different days. So it's a lot easier just working one day at a time, especially if you're having your caregivers complete their pay-only information. Okay, so that's the associate time entry option. The next one I want to talk about is the Oasis file build. Now, you will be putting Oasis into the system, and you'll have several different paths to do that. Oasis information is embedded into an integrated service note. So you would have like an initial Oasis assessment for your start of care with the yes, I'll answer your question in a minute. Uh, let me finish this thought and then I'll get back to that real quick. The Oasis file build will, where you're entering Oasis, all your Oasis is going to appear in your patient encounter on the Orders tab. You can either put Oasis in through an Oasis integrated service node. There are going to be times that you won't have a service node, but you need to complete an Oasis assessment anyway. All of that would be done through the Orders tab. Now, let me go back to the associate time entry since I do have a question that I just saw. Okay. This add pay only button. Typically, when you get up a screen, you'll have services scheduled. So this is a good example. I have nothing scheduled on the 26th, but I need to add a pay only. So I can select this add pay only link and add it. So that's why the link's up there, that it can be used. But typically you're going to try to insert it in between things. But if you have no services on a specific day, this is what it will look like. And you want to add a pay only either for PTO time, holiday pay, or something, then yes, the link can be used. Sorry, I missed that. Okay, now let's get back to the Oasis file build. When you enter your Oasis information, the Oasis information has to be in approved status. If you have individuals entering Oasis through service notes, you can have it come through as a completed or come through as an approved. Most locations, when Oasis is done through the service notes, they want their clinical team in the office to approve the Oasis. So once you approve your Oasis records, we call them or we classify them as being locked, which is a term that CMS came up with years ago. So they go through this whole process and then get locked. Now, when you're transmitting Oasis, you will be able to transmit all the Oasis records that have been logged up to this point in time, but you can make a decision that you don't want to transmit anything that maybe you logged today, that you want to have the cutoff date as of yesterday or maybe as of Sunday, even though they have been approved and logged. And so a lot of locations do move this cutoff date back so they're not sending records either from yesterday or today, even though they've been approved or locked. I think best practice is to go ahead and send whatever you have that's been approved. You had somebody complete it, and typically you'd have somebody else reviewing it and approving it. And the reason I say to me best practice is to go ahead and send everything is that if for some reason a day or two or three later you find a mistake in it that needs to be corrected, the whole process for Oasis is when you unlock that Oasis record, it's going to open it back up for you to make changes to it and relock it. When you go through that process, it's going to automatically reverse the Oasis record you sent and send another one in its place, Or depending on what the change is, we may just say send a corrected record to the one that you previously sent. So if the system does all that automated, you don't have to worry about going and reversing it. The transmission information, we do all that for you. So you lock and transmit. If you need to fix it, you'll unlock it, and it will correct the transmission files either by voiding one or voiding and reprocessing one, or sending a corrected Oasis record. So that's why I said best practice would be to just go ahead and send them, because you can fix everything in the system really easy. Now, there might be occasions that you want to look at the Oasis records that are going, and let's say that, if you look at the list, I selected the icon to look at the transmission file details. And if you said, something, I know there's something wrong with this Oasis record, just don't have time to look at it yet, I'm not going to send it. So if you check off anyone that you don't want to send during this transmission, it will hold it out of that transmission process. Now there's a little box up here that says show holds. If you check that, it'll add you a new column. So my original count was 16. I'm holding on to 1. So this, when I create the transmission file, is going to create the file for 15 of them. And then to send or build your Oasis file, you'll select this option. Now, you'll have the ability to transmit Oasis records because I'm not an active live agency. The only thing I can do with my setup is download. So it'll say something about creating transmission file and then closing it. So you will be able to transmit the Oasis information. Now that one that I said I was holding on to, it prepared it out here for another transmission file. And if you decide that you can send it now, you can open this up, remove the check mark, and hit save, and then you can build out the transmission file for this one. Okay, now when you send or when you build the transmission file, as like seconds after it's built, we will automatically pick up the transmission file for you. We'll send it to the Keys ASAP system for you. We will go and retrieve your final validation report. It will drop that final validation report into this automated reports queue, which you're going to learn about a little later on. We will also break up that report so you can, if you so choose, post the responses from that report to each individual Oasis record that's in the patient encounter file. Now, we will also scan that report. If you have any warning messages, we'll put the warning message information as a notification in Workbasket. If you have any error messages, like it got rejected, we will put the Oasis record in Workbasket. Will notify you that it was rejected. It'll be part of the action items as a to-do, which means you need to correct whatever the issue is, lock it back up, and transmit it again. So that's what's going to happen with all of Oasis. So you will be creating that transmission file so that we can transmit your Oasis as quickly as possible. Now, I recommend that you do it at least once a week, if not more often. We've had some offices that decided to do it once a month. If you have a reject, then it's a late submission. So I recommend doing it at least weekly. You could do it 1, 2, 3 times a week. If you want to run them every single day, just make sure this gets stuck in your process somewhere, that this gets done. Okay, I have another question. Can you clarify the system will not automatically transmit? That is correct. And we don't automatically transmit them in case you want to hold on to one. That's why we don't automatically transmit it. So you'll just want to make sure that this is part of their responsibility to build this file and send it. So that's why we don't automatically transmit. So, and it's because people may want to hold on to locked records for a couple of days. So the best practice to me is just send them. So that's why I said that's what I would do, is just send them, because you can always fix a locked Oasis record that has been transmitted. Even if you've billed, that whole process will reverse the billed invoices once you unlock and reprocess an Oasis. It will go through every single step. It'll reverse that. It will correct all the pieces, and then you send it all back again. Okay. Okay, once you build the file, that's all you have to do. Is under this processes menu is the Oasis file build. Once you do that, we take care of the rest of it for you. Okay, and then I've got another one, and we will set up the person who should receive the work basket notifications. That is correct. Typically, system administrators are set up to have access to all of work baskets. So if you neglected to set somebody else up to get the work basket notifications and action items, somebody in your agency would have that access. Okay. By the way, there is another piece in work basket, since you brought up work basket. If you don't transmit Oasis, there's a spot in your organization file that you can flag. If you don't transmit it within a certain number of days, and I recommend 7, that you'll get notified in work basket it hasn't been done. And that becomes an action item too. Okay. So the next thing, we've already talked about the Oasis validation post. There's something in our system, and if you choose to use this for your agency, you can. It's the clinical update review. It's a logic for home health that works very similar to your IDT reviews. And what you're really doing is like your weekly case conferences or team meetings that you're reviewing specific cases. And so it's a similar format as this IDT review. Both of those, our clinical team will go through and train with you. I have another question. Will a correction to a log file also go back to payroll? No, it's because what you're really doing is just correcting the Oasis record, so there's no payroll link to it. You may have done the Oasis in a service node, but there's once you log and transmit, make corrections to those Oasis records, you're already past that point. So there's nothing that impacts payroll for this. Okay. So we've gone through the clinical update, which is similar to the IDT, but it's really for your home health services. But it's the same or similar logic, and our clinical team will go through that. The home health patient survey. You're actually going to have one of these for home health, and you're going to have one of these for hospice. And so the hospice one, under the processes menu, there's going to be hospice patient survey. So these are for your patient satisfaction surveys. Now, when you run this information, it's run for a previously completed month. So since we're still in the month of January, the only one I can run is December and prior. So I can run one for December. If I need to recreate one for November, I can, and recreate one for October, I can. Now, in our system, we have a list of vendors, and these are the approved vendors by CMS that all of our offices are currently using. So these seem to be the most popular: Press Ganey, SHP Data, DSS FOSSI, RCC, and in the Arbor. These seem to be the most popular. If you're using one of these, then you are probably good to go from a patient satisfaction survey perspective. Now, there's a couple of them, and it depends. If you look at Press Ganey, you see there's two different formats here. Well, Press Ganey is a national survey vendor. They have regional offices, and they want this information in a different format when you send it to their regional office. So that's why you see two different versions sitting out here. Data has the same thing, so a couple of them you'll see two different versions. If you have chosen a vendor that's not part of this, that you want to continue using, then contact our CareVision support team. You're working, just got a notice, someone saying you're using SHP. Okay, well then your vendor's already set up, so I don't need to go through the rest of the spiel. Okay, so when you're running this, you're going to be searching for the information. I don't happen to have anything sitting out here for December, but you'll be searching for information, and based on the vendor you select, and the report will display on your screen. Now, you will be submitting this to your vendor based on their requirements. Some vendors let you upload this directly into their system, so you'll have access to sign into their system and just upload the information. Some vendors want you to send an encrypted email to them, and they'll take the file and upload it into the system. And there's a few goofy vendors that you have to rekey the data directly into their system. They give you access to it, but you have to rekey all the information. It's not a vendor I would have chosen. You guys have a good vendor. I've worked with SHP, so you guys have chosen a good vendor. Okay, so your satisfaction survey works the same way for a hospice as it does for home health. You've got the same screens, the same drop down. Everything is identical, so you just have a different option to create the one for hospice. Okay, now we told you that you needed to build the Oasis file so we could transmit it to the Keys ASAC system. You also have the option to build the hospice file. This one you have the same cutoff date. If I had hospice records that have been locked and ready to go, then they would be listed here. Screens pretty much work the exact same way. One's just for hospice, one's for home health. Be sure that this is also included in your process. So whoever you're going to assign responsibility to build the transmission files, that they do this. And like I said, make sure you do it at least once a week, if not more often. So a lot of locations are doing it 3 times a week. Some of the larger locations are doing it once a day, every day. So they either create it at the end of the day or it's the first thing they do the next morning, whatever's ready to go. IDT review, our clinical team's going to go through that with you. They're going to cover the complete process. This just gives you an option to see what's sitting out there for IDT and how to work with it. Now, we have an option for invoicing. We run invoicing every single night. We look at any invoices that appear to be ready to go. And what that means is that they have an end date either today or it's an older end date, which means you should be able to invoice them. We run it through the invoicing process. That invoicing process checks all the edits for you if based on payer requirements. And if it's ready to go and it passes all those edits, we will create the invoicing for you. That's done about midnight, so all of the invoicing information will be available the following morning. We will put reports in your reports queue. If you have paper claim invoices, they will sit in this automated reports queue. There is an invoicing report that tells you what got processed during that time frame. If you have electronic claims, we will have sent those claims electronically to the payment source. So your Medicare claims will go electronic to Medicare. And again, everything else will be paper claims like a UBO4, a 1500 claim form, a generic invoice. Those will all appear in your automated reports queue. The billing report also shows the electronic claims that were processed as well. And what all that does is it takes anything that was in an unbilled status and moves it to a billed status. Or if you're moving the invoicing from one payer to another and it passes all the edits, it'll move the invoice. Or if you're rebilling or reissuing the same invoices for some reason, it will do that. So everything's available to you the next morning. This option allows you to run the invoicing process now instead of waiting for the nightly run. Let's say you got a subpoena from an attorney that gave it to you at noontime today. And they said, oh, by the way, I'm going to be in court first thing tomorrow morning. Can I get them this afternoon? So they're saying they need clinical and financial information. All of the invoices you can create from here. If you need to reissue them, you can. And then run the invoicing so that they're in your hands today versus tomorrow morning. So you won't have to use this too often. It's just here if you need to have the invoices quicker than tomorrow morning. Sometimes you might find something like a state Medicaid program where you're getting really close to the statute of limitations and you want to get this done today. A lot of them now allow you to fax it, so you want them to have it today. You might have some payment source that constantly tells you they've lost the invoice or they don't have it, they've never gotten it. And you're saying, I'm going to print it one more time and I'm faxing it to your attention, and here it is, you'll get it this afternoon. So that's when you'd use this option. So all you have to do is hit the Run Invoicing Now. Now, when you run your invoicing, this takes about 20 minutes to go through the entire process. So it's going to start off being ready. Now, when I press my refresh, it's going to give me an error. It should give me one because I don't have the billing process turned on. But it will go through the process. It'll tell you the reports it's creating. It'll tell you the bill types you're creating and so on. So you can sit here on the screen and watch it. Here's my error. You can, when you run this, it'll say processing and it'll say processed when it's done. And so you could sit here for 20 minutes and watch it, but you may want to go and do some other things while it's running. So it's running in the background. This allows you to exit the screen and come back to it in 15, 20 minutes and see where it's at in the process. And then once it's completed, where you have everything for this time frame set process, all of your information will be in this automated reports queue. Okay, and again, this is only exceptions. You do not need to run this every day, only if you need something in your hands today versus tomorrow. You do have a pharmacy import. I'm going to take a guess that your pharmacy will give you the information to upload the medications and attach them to patient invoices. So, and I do believe, Molly, I sent you the documentation for that import. So I'm hoping that your pharmacy does give you the spreadsheet. This is the option that you can use to upload it. All you have to do is select this upload document. It'll post all the information on the screen for you that you've uploaded. Also tell you if you have any errors. Yes, I knew that was coming. Not sure exactly when that's going to happen, but I knew that was on the table. So if you're going to upload the information, then you'd be able to send or attach the information through this process. If for some reason something rejects, which on occasion they do, they might have the wrong NDC from the pharmacy, wrong patient identification or something. We put that in an errors file for you so that you can correct all the information and reprocess the errors. If you do have to use the upload pharmacy record information, the first time you do that, you can work with our accounts receivable support team. They'll go through and with you on that and make sure that you understand that entire process. So they'll work with you with your live data. Okay, QA review. This QA review process is also a clinical function that the clinical team's gonna go through with you. This QA review lets your QA people, QI people, clinical supervisors, managers review service notes that your caregivers have completed. And this whole process lets you send messages through the internal messaging feature to caregivers, lets you back out a completed service note into an incomplete service note, lets you attach, you could call them sticky notes, but they're really part of the messaging. And that tells you which sections you want them to take a look at and update or change or whatever you want to do. So that, again, our clinical team is going to go through. I'm going to ask the question. Are you guys set up to go through the review choice demonstration document gathering? Molly, that'd probably be a question for you. No, oh, good, good. So I won't cover it because that's what that's for. There's a whole process to allow you to gather all the documents for that thing. So I did, and I knew it hadn't been rolled out to everybody, but I know they're starting to push on it again. Then the last option down here is the view the physician documents. In CareVision, there is a physician portal available to physicians who want to sign their orders electronically. And this option gives you the ability to see what documents they have and where they're sitting in the process. So that's what this option does. Physicians see their own, but you can go and pick a physician and see what they've got. Now, this is initially set up for your external physician. So for home health, all your physicians are external. They'd be signing the documents, your orders, interim orders, and all of that stuff they'd be signing. There is a way to set this up for your hospice medical director and hospice physician, probably nurse practitioner, to be able to use this feature. It wasn't initially designed for that. Then we came up with a path to get that set up so that your hospice physician, medical director can use that portal piece to sign it as well. For your associates, they could go directly and sign it. So, like I said, our clinical team will go through that with you. If you want to use that, I recommend that you get some kind of agreement with the physicians who are going to use the electronic portal, something that says they won't be sharing their ID and password with their staff, that they're responsible for the signatures, electronic signature, and all those things. Okay, so now we can move on to the report. Jamie, I'm not sure what you mean by we are not in it. Oh, you guys were answering all of this. Okay. All right, so now we can move on to the reports. I want to cover the automated reports first. The automated reports are reports that we create for you and put in your print queue. There are a couple of times that you may want to have some reports batched instead of created and display on the screen. And when I go through the statistical reports, I'll explain that one because that's one you might want to change. Okay. So automated reports, you'll see things like a service note report that we create and put out here, and this is every day. There's one for patient fact report. We do that every day as well, and I'll talk about those two specific reports in a few minutes. But you'll have reports, you'll have like billed invoices report. So invoicing runs every single day. So whatever got billed hits the report. Your paper claim forms, this is a UBO4, this is a UBO4, and so on. So all this information gets dropped into the reports queue. You will be assigning individual access to the reports you want them to have. How to use this queue? If you want to download any of these reports and save them on a local PC, you can select those reports and select the download link. If you want to look between those that you've read or haven't read yet, you can toggle back and forth between those that are read and unread. So that just gives you an open envelope in place of a closed one. If you want to move any of these to an archive, so this is your current reports queue, you can move them into an archive reports queue. So those that I had checked off, I moved into an archive. Now you can also, if you decide you don't want any of these reports any longer, select the ones you want and drop them into the delete. And so that moves them into yet another folder. So just because I put them into an archive or moved them into delete, we're not removing anything out of the system. So we've not even removed anything in the delete file yet. But you can move items into delete if you think you'd never want to use them again. You can put them into the delete. Now, if you need to get to them, you can select your status. So I want to see the ones I archived. So these are the ones I archived. I can select one or multiples. I'm going to move these back into current. You can do the same thing for delete. So we'll take this and move it to the trash can. And these are the ones that I have in the delete option. I can move any one, multiples, or all of them back to my current file. And so let me get back into current since this is where all my reports are sitting. These report names are the links to open up the report. Okay, so there's a couple of reports I do want to talk about.
Craig, sorry to interrupt, but is there a list of all the reports that are already pre-built into the system?
They're sitting under the home page. There's a link to take you to a reports menu, and it shows you everywhere where reports exist and what the reports are.
Thank you.
Okay, when we get off this, I'll show you where that link is. Okay, so the reports that are sitting out here, there are two reports that we are going to drop into your print queue every single day. They are the service note report and the patient fact report. The service note report, it gives you all the service notes that you've created for the last 2 weeks. The patient fact report tells you everything you need to know about the patients that are either in an active hold or pending status. Now, what you're going to want to do is make sure you have these two reports downloaded and saved on some type of local device or portable device. So that would either be an external hard drive, could be a jump drive, or it could be a laptop, something that you can take away from your office. Okay, The service note report shows you every single service note that you have completed within the last 2 weeks for every patient. So you have a complete documentation for every one of your patients based on the service notes that have been documented. Okay, so the service notes, our clinical team's going to show you how the service notes function, how to use them, how to complete them, what to do with them. What this does is this is just a report that gives you all of these service notes that have been completed in the last 2 weeks. This is the notes. The notes has to be as part of the service note tab. So incomplete service notes do show up on the service note tab, and you can print them from there. This should have all of your service notes that have been documented, whether you've got them marked completed or approved or not. Okay.
Hi, Frank. Can I ask a question?
Sure.
So I just want to understand this properly, and I'm having a block. So you say every night we're going to get a report of service notes done at our agency, and the service note is a patient visit. So we've done a patient visit, and it's either going to show that the clinician, let's say in our language, we say entered their time and travel. So we know that the visit was done, but they still haven't completed their documentation. And we run reports called incomplete documents. So is this similar to that? It will show that a visit was done, and it will show whether the note is completed or the note is not completed?
It'll show you every single note that's been started. So you can start notes in the system and not complete them. It'll show you every single note that's been started.
Okay. Will it then also let us know if those notes are completed? Or
you will be able to tell this by looking at what we're really doing, and the purpose of this report is not, I think, what you're looking for. The purpose of this report is so that you can use it as part of your disaster planning process. So that if in the case of a disaster and your office is wiped out, you have this information available to you to continue running your business. So you can see all the notes that have been documented within the last 2 weeks. In the patient fact reports, the other side of this, you'll see all of your active, hold, and pending patients.
Okay, thank you.
And so that's the purpose of this report. Having incomplete service notes is done through Workbasket and some of the other processes reports. So you'll be able to see incomplete notes from there as well. So, but the intent of these 2 reports is that you have them downloaded to some type of portable device, either a laptop that you can take away from the office, a jump drive, or a external hard drive. And so these 2 reports are part of your disaster planning process. So you want to make sure you have that information available to you so you can continue operating your business in case your office has been wiped out. Now, I recommend that you have at least 2 people doing this, and that they live on the opposite sides of your coverage territory, because somebody might be wiped out on one side of town and the other person is up and running. They might have electricity or something. So at least 2 people. We have some people that every one of their caregivers downloads this every day, but they see the whole picture. Other locations that might be, and it might be a bit too much for an agency of your size, but I do recommend at least 2 individuals do this, and it has to be done every single day, and it should be included as part of your disaster planning process.
Thank you.
Okay, so let's move on to some of the other reports. Now, I'm going to go through the ad hoc reports. I'm going to show you how to add columns. There are other features and functions available to you for the ad hoc report. When we set up these reports, these are baseline reports that are sitting at the left-hand side. So I have a baseline report for the associate master file. I have a baseline report for patient notes and associate notes. Those are the notes tabs. This one is the patient details. So this is the patient encounter file. This is the payer detail. So this pertains to your organization payer, and you can look at how you've got your pay rate set up, your payer rate set up for them. You also have one for work basket. So these are baseline reports. There are other reports available to you that you can run. These are if you decide you need something specific on the report, and you don't have a standard report that we've created, then you would select one of the reports. So I'm going to select my patient detail report, for example. This is the baseline report. It shows patient name, it shows admit date, agency type, address, and all of these things. So the simple piece is most people said, okay, I know how to work with a spreadsheet. So let's make sure I have all the data on here. So the simple piece is just to go with the columns. You have a column sitting over the left. These are actually fields that are part of the patient encounter file. And you have your visible columns. These visible columns are these columns that we see in the base report. Now I can change this report. So let's say I want birth date on my report. So I'll just select that and move it over. You might want case manager on your report, so we can move that over. You might want gender on the report. You want discharge date and discharge reason, and so on. So you could have all this information that's for your available columns, and these are really reflected in fields that are in the patient encounter. Put them on the report. So this side will now show you everything that you want in here. Now the ones I added sit at the bottom of this list, like birth date, case manager, gender, and so on. You can take one of these and move it up. So I'm going to put this one just above age. So I have my birth date and age together. If you wanted to move your gender up, you could move this up so it's sitting next to the patient name. Let me move this up a little higher. Whoops. Here it is. Why are you doing this to me? You're goofing me over. Okay, so patient name and gender. I'm going to leave these other two at the end. So once I've added these columns, I'm going to just hit the apply. Okay, so I added those columns. So when I'm looking at it, I put my birth date next to age. So now that's a field on the screen. I think I have my gender next to my patient, so you can see it on the screen. The last ones I added were case manager, discharge date, and reason, so I just left them where they were. So if you want to keep the information this way, you can hit your save, and then you can have this one. I'm going to just put in case manager real quick and hit my save layout. So now I've got that layout saved. And so now if I go back to my reports, if I see my ad hoc reports, you'll now see that I have my case manager report as a special report that I customized. You still have the same baseline report that you worked from that you can do again and make some changes to. So this will allow you to rerun any of these reports that you need to. Now, as part of this ad hoc reporting, there are some other features like you can do a greater than or less than, or something should be equal to something specific, and so on. So those things are a little bit more complicated. I just wanted to give you a simple show of this. So when you start using the application and you think you need a patient detail report and one does not exist, so you've looked at all of the other patient reports that are available and one does not exist, you can contact our CareFish support team and we'll go through this with you with your data and we'll walk you through setting up the report in your environment and show you how to save it. So we'll show you all of the additional features to this. I just wanted to give you a quick idea of what this was about. Okay. Also in this report's the associate compliance. Now the associate compliance has several different filters and features to it. And you can also look at the compliance information for one or multiple agencies or all of them. I'm just going to go ahead and select one of my agencies out here. And so I selected this agency, and so these are all of the compliance items for this agency. It includes both those that are compliant and those that are not compliant. So the reason for that, and there's a box here that's checked, it says include compliant. The reason for that is there are some surveyors now that say, well, it's might be a little difficult to be 100% compliant. I mean, agencies work very hard at it, so they want to do a comparison of the whole. So if you were 98, 95 or 98% compliant, they would compare this to get that 2% and say, okay, well, they worked at this really well. I just may give them a talking to. If you were 90%, they may give you a stern talking to. Anything greater than that, they may give you a deficiency. So that's why we've included the compliance items that where an associate is compliant. Now, from a day-to-day usage, if you just remove this check mark, it will redisplay the screen and tell you that those that are not compliant. So that's what you get on the screen. Now, under the compliance section, you can pick which item or items you want to work with. So if I want to work with just two of these, I most likely remove the check mark from all of them. And let's say I want to work with my I-9 information and my hepatitis B. So those are the two I've selected. And I hit my search, and it shows those that are missing or have an NA, and it tells me these are not compliant. You also want to include the license, just check the license box and hit your search. And I'll tell you everybody that has an issue with their license information. Okay, now the license information, I do believe your agency set up to start looking at it 30 days before it expires. So this will start telling you 30 days before it's expired that it's about to expire. So it'll tell you the status is either it's expired or it's about to expire. So that gives you the information for your compliance reporting. We do default this to go back 6 months. If you are compliant anything older than 3 months, you could change these dates. If when you're running this for a surveyor, for example, if you need to take it back for a whole year or the reporting time frame they want to look at, then you'd be able to do that. I got another message on here. Can we change the 30 days to a longer period? I do believe you could put in 45 or 60 days. I haven't changed that in a long time, but it has a time frame. I knew some office that had 7 days in theirs, but let me look at that, Molly, and I'll let you know. I'm just making a quick note of this. Okay, some of those things have a max of a time frame. I know something in the organization file, the max is 90 days. So I'll take a look at that and let you know for sure. Okay, so that's the compliance report. So the next report I want to talk about, well, we can talk about the associate pay rates report. What this does is it gives you, maybe I should just leave that at all. Let me just leave this at all. So what this is going to do is identify your associates, the agency that you've set up the pay rates for. I'm sorry, their home agency, the service code that's used, the service description, and what the rates are. So that's what this screen or report gives you. So if you need to manage pay rates, this report will help you with that. So if you're giving any type of pay rate adjustments, and you can see who has that service code, service description, and if you need to adjust their pay rates, you can. Now, there's also one sitting out here for associate productivity. When we show you dashboard, you'll see a full-time caregiver productivity. This one actually shows you the productivity for everybody. So what it's going to do is give you their entire productivity on a report. Let me see if I can get this out. I'm going to change my date so I can get a little more information on here. So what this is going to do is going to give you a report. Usually individuals want to see productivity by the week, so we default it to a week time frame. But and the reason for that is you're kind of looking at overtime situations. You're kind of looking at their total productivity for that specific time frame, and usually you're looking to see how many units are you processing for the week. Now, this report does a couple of things. There's a productivity based on actual time, but you can also run this report and be proactive so you can see what's been scheduled. If you didn't schedule any time, then we'd use the calculations that you have set up for weighted visits for anything that's in the future. Anything that's been passed, we'll use the actual time that's been verified. So this report works both proactively, so you can see how productive they are in the future, and you can also see what they've done within the last week, or the last month, or last quarter. That's where this report comes in handy. Okay, authorization reports. There are three different types of authorization reports. There's an authorization due report. There's an authorization due report. Let me go ahead and select an agency sitting out here. Authorization due report. This one is where you can look at authorizations that are either have expired or about to expire within the next 30 days. You could change this to 90 days if you wanted to. And hit your search, and so it'll give you the authorizations that are about to expire in that time frame. So you can also run this by payer, very helpful, especially if you've got one specific payer that you need to look at all their authorizations because you're concerned about how they provide authorizations to you, and maybe you need to move this time frame up. I know we've got one or two offices that have a payment source that says you have to have your authorization request into us within 45 days, or we're not going to authorize you for the next period of time. So this will help you manage those authorizations that you need to gather. Also, under authorizations, you have authorizations missing. What this report does is it tells you, I'm not sure if I have anything in here any longer. Yes, okay, so this one tells you that you have patients that have service dates that have no authorization associated with them at all. So you don't even have an expired authorization, it just says you have no authorization associated with these at all. Then you've got your third authorization report. This one gives you, I actually like working with this one. We'll leave it at all payers, and I'm going to go ahead and back this up. This one gives you your patient names, who the payer is, each discipline. So if you're doing authorizations by discipline, they'll show the authorization numbers, your start and end date for this specific authorization, how many units have been authorized. So it could either be visits, hours, amount. So it would, how many units have been authorized and how many units you've used. So you can look at some of these and it'll show I've done 30, I have 0. This one I've done. I have 20 visits authorized. I've used 13 of them. I have 7. So it knows to be looking for this type of information to create this report. So this just allows you to keep on the top of authorizations you may need coming up if you think you're going to continue patient care. So this is a nice report. I like working with this one because I can see authorizations I've received and authorizations I've used. Okay, care plans without a bereavement. Our clinical team will be discussing that with you. Dma report, this actually shows you the DME that's in the patient's home. For your hospice business, you will, if you discharge that patient, then you'll get a work basket item telling you need to pick the DME up and then put in a return date on the system. For your home health, if they have DME when you discharge them, you don't have to do anything. Face-to-face due is also another clinical report, but this basically tells you that the face-to-face is due for your hospice physicians for every 60-day certification period, so that will be available to you. Another question, can you look up an individual or does the report only pull everyone? It depends on the reports. Most of these pull for everyone because these are what we refer to as global reports. So they typically pull for everyone. If you see an individual's name listed here, then you know you'd be able to pull it. So these reports typically pull for everyone. There are some that you can filter. So for example, this one patient name, if you wanted to look at a specific one, then you can filter it and that's all you see. Okay, so this is the authorization report. So if you wanted to look at a different individual, if I wanted to look at Carter, I could pull Carter out of my drop down and I can see just Carter. So some of them do have filters where you can do by individual patient name, by payer name, and some don't. So some of the reports are, like I said, what we refer to it as a global authorization report or a global report. Okay, back to uh, a person must fill in this report, or does it populate from somewhere? And as you're entering, you enter authorizations into a patient encounter organization payer on the authorizations tab. So if a payer requires authorizations, that's where that information gets input. This report takes authorization information, the specific one we're looking at, and compares it to scheduled and verified services. So that's what this report does. So somebody doesn't have to fill in this report. You're just entering authorizations as you receive them and attach them to patient encounter payers. You schedule services and verify them, and this report is looking at all that information. Okay. Form data report uses the electronic forms. That's another piece our clinical team is going to work with you, as well as the forms. There is a list of the home health QAPI reports. This is another piece our clinical team is going to cover. I'll just open this one up real quick. And so on the QAPI reports, these are the different types of reports that we have out there right now. All of them, I think, except one, are working from Oasis information. So it's going to be looking at Oasis questions from admission and comparison to discharge. Okay, I have a question. Go ahead.
Hi, I'm sorry, this is just about the authorization again, because this is an ongoing thing in our agency, so I just really want to understand it. Because we get auth from different insurance companies, and then our schedulers who obtain the auth keep their own individual spreadsheets. So let's say they get auth from Kaiser on these 5 patients and how many visits they got and how many they used, and they have to keep going in and manually updating. I got 6, I used 2, I have 4. So if Kaiser gives us, 6 visits and it's someplace in Care Efficient, that's going to populate this report that we have 6 visits, and as we use visits and they go away.
Let me open this up real quick. I'll pull a page of, I think Coventry is the one that uses authorizations. What you're doing is you'll be adding those authorizations to the payer. So I'm in the patient encounter for this patient. And then I'm going to go to the payers tab. This payer requires authorizations. Right now, my authorizations have either expired or they're ended. Okay, so this is where I don't have any authorizations in here. And so this is where you'd be adding your authorization. Now, payers determine the type of authorizations you're collecting. My payer says I'm doing authorization numbers required. I'm authorized. My authorizations by discipline. It's not a service. It's not visits. I don't need hours or units or dollars. And so when you're adding your authorization, you put it in the system. I'll just go ahead and add authorizations real quick. If you need assessment visit and you do an authorization for a separate one, then you'd need that. I'll just go ahead and put something in here. And then you put in whatever the units they've authorized. And then who gave you the authorization. And you can save and add more. Now, from a scheduling perspective, when I schedule the services, it's going to compare to my authorization that I entered and tell me if I've got authorizations that cover those scheduled services or not. So scheduling automatically is looking at the authorization you entered here. And then that report, the authorization reports that we're doing, let's see, it's up here a little further. This report, it writes the authorization information. So this is the authorization I entered for that payer. This is going to show me the authorizations I've used. And that's looking at the scheduled, that's looking at the scheduled services, the verified services. So in scheduling, and it depends on how you want to do this, in scheduling, you could have a pop-up that gives you a warning that says, this patient doesn't have authorizations. Should I continue? You can also have that set up so it gives you an error message. So if you don't have authorizations, you cannot continue. So what you were explaining to me about the spreadsheet, the system does that automatically. Now, this might be something a little bit harder for them to get used to, so I think they may start keeping their spreadsheets as well as authorizations put in the system, but the system monitors all that for you. Okay. So let's go back to our list. I think I was a little further down. Medication administration. This is available to you for both home health and hospice. What this does is it allows you to review any of the medication administration process that you've gone through. Our clinical team is going to go through that whole medication administration, setting up the medication profiles, pre-filling medications, making sure that they've taken their medications. There's an entire process to go with that, and this is the report. Note form report also is a report that our clinical team is going to cover, but this one actually allows you to print all of your automated forms, blank forms, so you can print the whole group. So if you wanted to see all the ones for the patient, ones for associate, this one will also allow you to print different service notes. So it gives you an opportunity to print them to see what they look like. So that's what this option does. Oasis Report just tells you the status of the Oasis records all the way through initiated, completed, approved, logged, transmitted, who give you that. There's an orders report that tells you the status of all the orders, whether they're a 485, a care plan, any type of interim order. And it'll tell you whether it's at the initiated stage, saved stage, approved, sent, mailed, signature received. You have a patient measures report. This is part of the value-based purchasing. I don't think California is involved in the value-based purchasing program, but that's what this report's for. It follows the format for value-based purchasing. You probably never use it until they decide to roll that out. Then there is a Pdgm report. Boy, this one, let's see if I can get because I haven't refreshed my thing sitting out here. Let's see if it'll give me no, I didn't think I had one yet. Since Pdgm, since the new Pdgm for 2021, we have to have some information built into my training file for me to show this to you, but it shows you the patient, the Pdgm payer. So if you have non-Medicare payers that are using the Pdgm process, then it shows you that the invoice number that's been generated, the from and to date of the invoice, the status, that you'll get to see the HIPS code, your LUPA threshold, number of visits you processed, your wage index, case mix, episode value, and so on. So the report will give you all this information. I do recommend, even though I can't show you the detail on this report, I do recommend that you run this at least a couple of times a week, because with the volume of business you have going through, you want to make sure that you're on top of all these different things, because you could get caught with lupus situations and may not know it. So I do recommend that you have look at this report at least several times a week. Then that's the Pdgm reports. There are also QAPI reports for hospice that our clinical team's going to cover. They'll go through the service note report. Now, the service note is the same as the service note report that we put in your automated reports queue. This one allows you some more flexibility. You can pick time frames if you wanted to look at them for 1 week or the last 3 months. Service notes, when you learn how service notes are put together, you'll see that they have sections and items. You'll be able to pick out sections and items and so on. Then there are some situations where an RN may need to sign for documentation for an LPN or an LPN or some therapists may need to sign for PTA, STA, or CODAs. So that's what that report's for. And again, our clinical team's going to go through that. Then the last one that I'm going to show you has to do with the statistical report. Now, you can pick your agency out of the group. You can pick your agency type. Since you do have 3 agencies, you'll have those to pick from. Then you can pick a reporting group. If you're going to be picking agency type, you could probably leave it as all for reporting group. If for some reason you need to have some type of reporting group attached to an organization payer, then you'd be able to create some statistical reports for that specific payer if you label them as a specific reporting group. Does default to a date range of 30 days prior from today. You're going to have 3 different types of reports. You're going to have a PDF report, which of course are pictures of the information. And so these PDF reports use anything that you check down the left-hand side of the screen. And so these are baseline or canned reports that we've already got set up. And so what you can do for these, and just ignore where it says home health or hospice on the screen, just ignore those. You can run any of these reports for any of your business. So if you needed to run this one for a hospice, you can check it. If you needed to run one down here for home health, you can check it. You can run them out of any area on here, because they are still looking for the data elements that you do have in the system. The one that probably won't mean anything for home health is this hospice DART report, because it's admissions and discharges by initial place of service. So you're not documenting that exactly in home health. So again, these are canned or standard reports. You can run them in a summary format. And all that is just summarizes the information, and you'll get to see these in a few minutes. You can run it in a detail format. You can also run a summary and a detail. And I'll just select a couple down here as well. Okay. Now these use the PDF report radio button, and you select your export. So I'm going to let this run. This particular report I have queued, so this one's going to go into my reports queue. I do believe in your initial setup, all of these will display on the screen. And then if you decide they're taking too long to display, then we can set them up so that they go into the reports queue like this is going to. The issue with this is if you run this for a whole year and you have a large volume of data, you could be sitting on the screen for an hour, because if you close the screen down, then it stops running the report. So that's why I said that some of them, if you run them by a month or a quarter, some of the information is very minor, then you could have it just display on the screen, because it may only take a couple of minutes. I will show you that once I go back to the reports queue. Okay, there are going to be occasions, maybe not necessarily with Medicare, but other payment sources, that there is something that they need from a statistical perspective for patients that is not included in any of these reports. If that's the case, you'll select the patient spreadsheet option and select your export. Also, if you have something that's service related that the payment source is asking you for, and it's not in any of these reports, then select the service spreadsheet and hit your export. So both of these reports, because they're in spreadsheets, you can reorganize, resort, subtotal, do whatever you need to get the statistics that are needed. So you have 3 different options. PDF reports are the standard reports, and then you have spreadsheets for patient and service. Now I want to show you if it's done running. the automated report, yes, it's done running. And the reason I'm showing you this is that what it's going to do is show you everything in one file. So even though I ran several different reports, you'll see them in one file. So here I ran the service code summary. This was patients and visits by age ranges. This is the detail report for this one. This one's by gender and age summary, and I do believe I ran that in detail as well. So they're all in one file. So it just creates one great big file for you, and all of these reports appear in this file. Okay. So that gives you an idea about what these are for. Because your agency's relatively good size, I would probably suggest that maybe we take a look at some of these statistical reports and put them in the automated reports queue versus them displaying on the screen. Okay. So do I have any questions about anything you've seen today? Okay, well, this actually concludes today's training. So tomorrow I'm going to go through Dashboard. I'll show you how to set up Dashboard, how to work through Dashboard. I'll show you something called a whiteboard, and then I'll show you a full-blown work basket. So if I don't have any other questions, you guys have a great rest of the day, and we'll talk to you tomorrow.
Great. Thanks, Craig. We'll talk to you.
Thank you.
Okay, take care.
Bye-bye.
Bye.